Good morning, everyone. So, today I will be teaching the humerus, right? The humerus, and I'll also be talking about the shoulder joint. Okay, so which type of bone is the humerus? It's a long bone. Okay, it's a long bone. And what are the characteristics of a long bone? It has a medullary cavity. It has two ends, one shaft, the lower end shaft, and the upper end. Okay. Now, what are its presenting features? Right. Coming to the upper end, it has a head, and there are three types of neck. I'll be talking about those. First of all, the head. See, the head of the humerus articulates with the glenoid cavity of the scapula, right? It is almost half of a sphere, okay, and it makes an angle. It makes an angle with the shaft. Okay, you can see this head is directed backwards and medially, and the shaft is directed downwards. Okay, so this head and shaft make an angle which is called the angle of torsion or the angle of humerus. It is 164 degrees. Okay, now there are three types of neck. First of all, the anatomical neck. It can be seen here, the constricted part. This is the anatomical head. Then you have the anatomical neck. Okay, anatomical neck. Then you have the surgical neck. How to differentiate, how to identify the surgical neck? See, there is a surgical neck. Okay, just keep this in mind. There is a surgical neck. Now, how to identify the surgical neck? Right, behind the surgical neck runs the posterior circumflex humeral vessels and the axillary nerve. Which one? The posterior circumflex humeral vessels and the axillary nerve. ভাইভাতে জিজ্ঞেস করে, how did you identify the surgical neck, or how will you identify the surgical neck? Okay, now coming to the morphological neck. The morphological neck is just 0.5 centimeters above the anatomical neck. It can't be seen in adults. However, it represents the fusion of the epiphysis and the diaphysis. Now you all know what is an epiphysis, diaphysis, and primary ossification centers, secondary ossification centers. Okay, now after the head come the tubercles. Okay, this tubercle which is projecting forwards, a little forwards, is the lesser tubercle, and here this one which projects just above the humeral head, this is the greater tubercle, right? Now coming to the lower end, directly and shafted ব্যাপারে বলবো. Coming to the lower end, you have the capitulum, this one, the sphere like structure. You have pulley like structure just medial to it. Okay, there is a trochlea. Okay, the trochlear notch, right? No, not the trochlear notch, it's the trochlea. Okay, trochlear notch is present in the ulna which articulates with the trochlear with the trochlea. Okay, like this. Okay, it's a structure in the ulna, the trochlear notch, which articulates with the trochlea. The capitulum articulates with the head of the radius. Okay, now this is a medial epicondyle present medially. This is a lateral epicondyle present laterally. There are three fossas. Okay, the three fossas are above capitulum is the radial fossa, above the trochlea is the trochlear fossa, and just posteriorly to it, just on the posterior surface, this one is a massive fossa which is called the olecranon fossa. Okay, so there are 5 non-articulating parts of the humerus, okay, which are the medial epicondyle, the lateral epicondyle, and the three fossas. Okay, and there are articulating parts which are the capitulum and the trochlea in the lower end. Okay, now coming to the shaft has 3 surfaces and 3 borders. Coming to the anterior border, the anterior border is present between the radial and the trochlear fossa, okay, and continues till the lesser tubercle, anterior part of the anterior part of the greater tubercle, okay. Coming to the medial border, the medial border is present medially, and it continues till the lesser tubercle or the medial lip of the intertubercular sulcus, you can say. Coming to the lateral border, the lateral border continues from the lateral epicondyle and goes posteriorly till the posterior part of the greater tubercle, okay. Coming to the 3 surfaces between the anterior and the medial borders is the anteromedial surface. Between the anterior and lateral border is the anterolateral surface, and coming behind between the medial and lateral borders is the posterior surface, okay. It is the posterior surface. So if you are asked to hold it in anatomical position, you have to keep some points in mind, okay. The head is directed medially and backwards. The olecranon fossa is present posteriorly. That's it. And your anatomical position will be like this, right? It will be like this. You will hold it in your left hand, since this bone which I am holding in anatomical position is the left humerus. Always keep the bone on the side of which the bone is present, okay, where the bone is present, on the same side as the bone, right? Keep the bone on the same side as the bone. And yes, these are the presenting features. Now we'll come to the muscle attachments. Coming to the upper end first, okay. Coming to the upper end first. Ki ache? Now in the upper end, on the medial aspect of the lesser tubercle, there will be the attachment of the subscapularis muscle. Right? Coming to the greater tubercle from above downwards, from the tip on the posterior surface, from above downwards are supraspinatus here, infraspinatus here, teres minor here, okay. From above downwards, going from tip to posterior surface, Now coming to the intertubercular sulcus, the intertubercular sulcus provides passage to the long head of biceps, and it has medial and lateral lips and the floor, okay. The medial lip gives attachment to the teres major muscle, okay. The floor gives attachment to the latissimus dorsi muscle, and the lateral lip gives attachment to the pectoralis major muscle, right? So medial lip gives attachment to teres major muscle, floor gives attachment to latissimus dorsi muscle, and the medial lip gives attachment to the pectoralis major muscle, right? Okay. Now coming to the rotator cuff muscles, as I said, On your medial aspect of the lesser tubercle is present the subscapularis muscle, greater tubercle. From above downwards, from tip to posterior are supraspinatus, infraspinatus, and teres minor. Supraspinatus, infraspinatus, teres minor. These four muscles are called the rotator cuff muscles. They are very important, okay? And short note, ashte pare, okay? As a short note or as a subclinical question, clinical question under the clinical questions, right? You have a clinical question on shoulder joint, ওইখানে আসতে পারে, ঠিক আছে? So how is the arrangement actually like? It's like this, right? It's like this. My coracoid process has broken actually, but it's okay. So what are the muscles here? This one is a subscapularis muscle. This one is a supraspinatus muscle. This one is the infraspinatus muscle, and this one is the teres minor muscle, right? This one is the subscapularis, supraspinatus, infraspinatus, and teres minor muscle. The rotator cuff muscle it provides stability to the shoulder joint, and it holds the large massive head of the humerus against the shallow glenoid cavity in position, right? Okay, this is all about the upper end. Coming to the shaft, lower end ta bole dicche age, yes. So coming to the medial epicondyle, the tip of medial epicondyle gives attachment to the superficial flexor group of muscles of the forearm, okay, and the ulnar collateral ligament, while the radial epicondyle gives attachment to the radial epicondyle and the superficial group of extensor muscles of the forearm, okay? Yeah, superficial group of flexor muscles and ekhane superficial group of extensor muscles of the forearm, all at the tip of the respective condyles. Okay, just above the medial epicondyle on the anterior surface here is present the pronator teres, okay, just above the medial epicondyle on the anterior surface, while on the posterior surface, in the lateral epicondyle posterior surface, there is the presence of anconeus, okay, anconeus muscle. Now behind the medial epicondyle, you will, or rather the impression is a little on the anterior surface only here, okay. This groove, okay, is made by the ulnar nerve, okay. The ulnar nerve grooves the medial epicondyle and enters the forearm, right? Okay, so this is all about the attachments on the lower surface, the lower end. Coming to the shaft from above downwards, okay, from above downwards আমরা করব। আচ্ছা, so as I said, this is the anterior border, this is a lateral border, and this is the medial border. The anterior border limits the anterior limb of the deltoid tuberosity. Deltoid tuberosity কোথায় আছে? Deltoid tuberosity টা আছে এইদিকে. It's not much prominent. Okay, deltoid tuberosity, it gives attachment to the deltoid. ঠিক আছে? তারপর হচ্ছে the lateral border. The lateral border forms the posterior limb of the deltoid tuberosity, right? On the posterior surface there is a groove which is called the spiral groove. There is a spiral groove like this. It runs like this actually. It runs like this. Acha. So first, talking about coracobrachialis, near the middle of the shaft there is a rough impression of coracobrachialis muscle, right? Coracobrachialis muscle. Near the coracobrachialis muscle, it is not prominent in my bone, it might be in your bone. Near the medial border is present the foramen, okay, nutrient foramen, for the passage of the brachial artery. Not the brachial artery, the nutrient branch of the brachial artery, right? Right. So this is coracobrachialis muscle. Now coming to the anteromedial surface. The anteromedial surface, it has a medial border. The medial border is sharp at the lower end and it forms a supracondylar ridge. Okay, lower end and in the medial end also. Supracondylar ridge, medial supracondylar ridge, right? Now the medial supracondylar ridge gives attachment to the medial septum, medial intermuscular septum, which is pierced. Okay, near the middle, it is pierced by the ulnar nerve and the superior ulnar collateral artery. Okay, or the inferior branch, I think, the inferior branch of the superior ulnar collateral artery. Okay, and near the medial end, above the medial epicondyle, the medial intermuscular septum is pierced by the posterior branch of the inferior ulnar collateral artery. Okay, posterior branch of the inferior ulnar collateral artery, right? Now talking about the intertubercular sulcus, or also called the bicipital groove. As I said, the muscle attachments, and it provides a passage to the long head of biceps and the anterior and the ascending branch of the anterior circumflex humeral vessel, artery. Okay, anterior circumflex humeral artery, right? Now in the lower end, okay, in the lower end, covering the anterior and anteromedial and the anterolateral surfaces, is the brachialis muscle, which covers the V-shaped insertion of the deltoid on the deltoid tuberosity. Okay, it houses the V-shaped insertion of the deltoid tuberosity, and on the deltoid tuberosity is present the deltoid muscle. Attached is the deltoid muscle, which then goes above like this. Okay, it covers the entire surface of the humerus, and beneath the deltoid is present the subacromial bursa, which we will be talking about in the shoulder joint. Okay, right. Coming to the anterolateral surface. Okay, the anterolateral surface on the lateral intermuscular septum On the lateral intermuscular septum is present the on the lateral border. Okay, the lateral border is sharp at the lower end and it gives attachment to the lateral intermuscular septum. Lateral intermuscular septum. The lateral intermuscular septum is pierced near the middle, okay, by the radial nerve, and the descending branch of the profunda brachii artery. Okay, the I think the anterior or the posterior. Okay, it will देखिए the anterior or posterior branch of the profunda brachii artery, right? Okay, as I said, the anterior here is the brachialis muscle. Okay, deltoid coracobrachialis. This is the thing. Now coming to the posterior surface. On the posterior surface, yes, one thing which I forgot to tell you. On the lateral surface, in the upper part, upper 1/3 is present brachioradialis muscle, and in the lower 2/3 is present the extensor carpi radialis longus muscle. Extensor carpi radialis longus muscle. ठीक है? Right. Now coming to the posterior surface, right? The posterior surface, there is presence of the spiral groove, the radial groove or the spiral groove, which provides passage to two structures, the profunda brachii artery and the radial nerve. কিভাবে যায়? The profunda brachii artery and the radial nerve, they pass through the spiral groove and reach the anterolateral surface of the humerus, right? Above the spiral groove is present the lateral head of the triceps, and below the spiral groove is present the medial head of the triceps. Also the deltoid is present near the medial near the lateral end. Okay, near the lateral end, deltoid is also present along with the lateral head of the triceps above the spiral groove, and below the spiral groove is present the medial head of triceps. So this is all about the humerus. I hope I have not left anything behind. I have told you everything about humerus. Yes, it has 8 ossification centers. Okay, 1 for the shaft, 4 for the upper end, and 3 for the lower end. Okay, or I think 3 for the upper end and 4 for the lower end, right? 8 ossification centers. It's not much important for you all. Okay. Now coming to the shoulder joint, right? Coming to the shoulder joint. What is the type of shoulder joint? What joint is the shoulder joint? It's a ball and socket type of synovial joint. Okay, ball and socket type of synovial joint. What are the articulating surfaces? The head of the humerus and the glenoid cavity. Okay, the articulating surfaces are the head of the humerus and the glenoid cavity. Now in your exam, if they ask you about the shoulder joint, you have to talk about the ligaments, blood supply and nerve supply. Okay, you have to tell the blood supply, nerve supply and the ligaments. they will ask you to enumerate the ligaments max to max. They might ask you about the capsular ligament. The capsular ligament, it extends on the margin above, beyond the margin of the glenoid cavity. Okay, it also houses a supraglenoid tubercle, so the long head of biceps actually runs within the capsule of the shoulder joint, right? And here in the humerus, the capsular ligament is attached to the entire head of the humerus and extends on the medial aspect till the surgical neck of the humerus. Okay, it is attached to the anatomical neck of the humerus except on the medial end, on the medial aspect where it extends till the surgical neck, right? And also it provides the synovial or the capsule synovial membrane. Okay, the synovial membrane and the capsular ligament, they provide an opening through the intertubercular sulcus, there are other two openings also. One is the subscapularis bursa, the subscapular bursa, which is just below the coracoid process in the scapula. Okay, just below the coracoid process is present the subscapular bursa, and the infraspinatus bursa is present posteriorly. One is present anteriorly and the other is present posteriorly. Okay, and there is another very important bursa which is called the subacromial bursa. সব বলে দেবো। ligaments কি enumerate করতে হবে। What are the ligaments? Many ligaments are there, নামগুলো বলে দিচ্ছি এক এক করে। One is capsular ligament. The next is glenohumeral ligaments, which are actually three: superior, middle and inferior. Okay, superior, middle and inferior, these are the three glenohumeral ligaments. Then you have the coracohumeral ligament. Okay, you have the coracohumeral ligament and you have the transverse humeral ligament. Coracohumeral ligament এর নামেই দেখা যাচ্ছে coracoid process থেকে it is getting attached to the humerus. Then you have the transverse humeral ligament. The transverse humeral ligament actually attaches between the lesser tubercle and the greater tubercle, or the medial and the lateral lips of the intertubercular sulcus, and it converts the sulcus into a foramen. Okay, transverse humeral ligaments. And glenohumeral ligament from the glenoid cavity to the humerus, right? Simple terms, nothing much complex. Right, now you have the accessory ligaments. You also have to talk about the accessory ligaments. You have the coracoacromial ligament and the coracoacromial arch. This is the arch, my finger, this is the arch which is formed. This is the coracoacromial ligament. This is the this is the acromial process. Okay, the acromial process, actually, yes, there is a coracoacromial arch. This is the finger of mine which represents the coracoacromial arch. And what do we see here? There is a coracoid process, this is the acromial process, this is the ligament, coracoacromial ligament, and this arch provides stability to the shoulder joint. It acts like a hoodie যেমনি আমার মাথায় যেটা পরি, like that, the hoodie of the shoulder joint. Okay, so this is all about the ligaments. Coming to the bursa, as I said, there is subscapular bursa, infraspinatus bursa and the subacromial bursa. Subacromial bursa, it is present beneath the deltoid process, the deltoid muscle. Actually the thing is, there is a shoulder joint. Okay, there is a shoulder joint right? This is the supraspinatus muscle. This is supraspinatus muscle. Wait a minute. Right. This is supraspinatus muscle, right? Beneath the supraspinatus muscle is present the subacromial bursa, and the subacromial bursa extends all the way laterally, and it is also present beneath the deltoid, okay, the deltoid muscle. Then it is called the subdeltoid bursa. So beneath the supraspinatus muscle, but just above the fibrous capsule or the capsular ligament is present the subacromial bursa, right? The subacromial bursa. Or no, actually it's not like that. Actually no, acromion ta hobe opore, ঠিক আছে? The acromial process will be present above, okay, and this is the space here is the subacromial bursa. The supraspinatus is actually getting attached like this, okay? It is actually getting, it has inferior relation, okay? And from the subacromial bursa, from this acromial process is present the deltoid muscle, okay? Deltoid then continues, okay? So supraspinatus and the fibrous capsule, they are present inferiorly, while the acromial process and the deltoid are present superiorly, okay? Right. This is very important, as if there is calcium deposition in the subacromial bursa, then it leads to subacromial bursitis, okay? Subacromial bursitis. You need to enumerate the ligaments, you need to enumerate the bursas, okay? The relations now. See, talking about the anterior relation, anterior subscapularis ache, subscapular bursa ache, right? And the deltoid muscle ache, right? Inferiorly you have the long head of triceps, right? Long head of triceps, and the one which was running behind the surgical neck, which is the posterior circumflex humeral vessels and the axillary nerve, okay? The axillary nerve. Coming to the posterior relations, the posterior relation ব্যাপারটা হচ্ছে the deltoid is getting attached like this, okay? The deltoid is getting attached like this, so posterior থাকবে, posterior deltoid থাকবে, and also on the lateral aspect deltoid থাকবে. So posterior কি থাকবে? deltoid থাকলো, ঠিক আছে? আর কি, হ্যাঁ, infraspinatus bursa আছে, ঠিক আছে? infraspinatus bursa আছে, and on the lateral aspect again deltoid, and you have the short head of biceps, the coracobrachialis, these things, right? Relations মোটামুটি most important হচ্ছে axillary nerve, radial axillary nerve and posterior circumflex humeral vessels, deltoid, and your subacromial bursa, okay? superiorly আছে, ঠিক আছে? superior, ঠিক আছে? superiorly তোর আছে subacromial bursa, supraspinatus, deltoid, all this, right? তো এটা দরকার, ইম্পর্টেন্ট আছে। Now coming to the blood supply, the arterial supply. The arterial supply is by 3 arteries, okay? 3 arteries: subscapular artery, supraspinatus artery, and anterior and posterior circumflex humeral artery, okay? Nerves, 3 nerves: axillary nerve, musculocutaneous nerve, supra You have supraspinatus na, suprascapular artery, ठीक है, suprascapular, subscapular and anterior and posterior circumflex humeral arteries. These are the arteries. Nerves: axillary nerve, musculocutaneous nerve, and the suprascapular arteries. Okay, now talking about the stability of the shoulder joint. Shoulder joint stability কে form করে? You have the rotator cuff muscles, যেটার উপর short note আসতে পারে. Okay, just name the rotator cuff muscles কোথায় কোথায় আছে. Subscapularis is present anteriorly, supraspinatus superiorly, infraspinatus and teres minor posteriorly. Okay, supraspinatus superiorly, infraspinatus and teres minor posteriorly, right? And your this one, you know, the subscapular is present anteriorly, right? And also what is the use of rotator cuff muscles? You have to write this. Rotator cuff muscle holo, then you have the glenoid labrum. Glenoid labrum is another ligament, though it is a fibrocartilaginous ring boli amra, but it also falls under ligaments, ठीक है. Glenoid labrum, which deepens the shallow glenoid cavity. Then you have the long head of biceps, which also acts like a groove, bolchi hood. It acts like a hood, like this, okay, like this, long head of biceps. Archi, yes, and the coracoacromial arch, another hood, coracoacromial arch. These four structures provide stability to the shoulder joint. Now shoulder joint movements. What are the movements? First, what is abduction, adduction? Abduction, as a simple pati, okay? Abduction means to minus, okay? You are taking the structure away from your body, it is minus, and adduction, add. You are taking the structure towards your body, okay? Abduction. See, for shoulder joint, abduction, adduction is different, okay? What I am showing is for shoulder joint, flexion and extension. A flexion, flexion, extension, right? What is abduction, adduction? This is abduction, okay? Abduction, adduction, not flexion, extension. Okay, flexion, extension is like this. Now when you know circumduction, right? Circumduction is first flexion, then abduction, then extension, then adduction, ঠিক আছে? So flexion occurs like this, okay? You take your hand forwards and medially, this is flexion, this, and then you take it backwards ekdom 180 degree, okay? That is extension, right? Now you are doing this is abduction, and you are taking it down, this is adduction, right? Abduction, adduction, flexion, extension, right? 4 movements: flexion, abduction, extension, adduction. This entire process is circumduction in a sequence: flexion, abduction, then you have extension and adduction, right? I am not showing you all the movements now because I don't have the enough display to show you how the movements are occurring. But anyone having doubt regarding these movements, you can come to me I'll explain it, right? This is abduction, this is adduction, flexion, extension, right? These are the movements of the shoulder joint. How are we doing this? Like, এত wide variety of movements কি করে হচ্ছে in the shoulder joint? Well, it is because of two things. The joint capsule is lax, okay, it is flexible, right? And it has a huge stability. The shoulder joint has a huge stability of its own because of the rotator cuff muscles, the glenoid labrum, the long head of biceps, and the coracoacromial arch, right? Now the movements ache, movements se you will be asked which muscle produces which movement, okay, which muscle produces which movement. This is asked mostly in your theory, ঠিক আছে, mostly in your theory. Before that, coming to dislocations, shoulder joint has anterior dislocation, posterior dislocation, and mostly equally anterior and posterior, but most common is anterior dislocation, right? Anterior dislocation. Why it is due to why it is so? Due to the defect in the glenohumeral ligaments, okay, which are actually responsible for its anterior part protection, okay, for the protection of the anterior part, right? So if any damage occurs in the glenohumeral ligament, the anterior aspect of the humerus will get dislocated. When the humerus is actually abducted, externally rotated and extended, right? Abducted, externally rotated and extended, right? In an extended, abductically rotated, abductically placed, externally rotated, in that position, in this position actually, okay, in this position. Your external rotation means this, right? So this, right? Now medial and lateral rotation ব্যাপার বলতে ভুলে গেছি, right? So keeping your hand like this, this is medial this is lateral rotation, okay, till this lateral rotation, this medial rotation. These are the movements of the shoulder joint. So anterior dislocation is the most common, এটা উপর একটা clinical question আসবে, right? Why is the anterior dislocation common? Because the glenohumeral ligaments might get damaged. Again, there is another question which is inferior dislocation, okay, inferior dislocation. Why is it so? Because the rotator cuff muscles, subscapularis guards the anterior aspect, supraspinatus guards the superior aspect, infraspinatus and teres minor guard the posterior aspect. But কে guard করছে inferior aspect কে? No one. In fact, there is an axillary nerve in the inferior aspect of the shoulder joint, right? So due to the absence of the rotator cuff muscles in the inferior aspect of the shoulder joint, or any muscle for that matter, inferior dislocation might occur in the shoulder joint, and that can lead to damage to axillary nerve. Axillary nerve damage hole ki hobe? Axillary nerve provides supply to deltoid muscle, right? Keep this in mind, okay? Axillary nerve provides attachment to the, gives supply to the deltoid muscle, and when the axillary nerve gets damaged, then the deltoid muscle gets paralyzed. The deltoid muscle gets paralyzed, and what will happen when the deltoid muscle will get paralyzed? the overhead abduction of the shoulder joint is not possible. Overhead abduction of the shoulder joint not possible, right? Abduction has a mechanism, right? Abduction এর ডিগ্রি কত, এক্সটেন্ট কত, 120 ডিগ্রি, okay, 120 ডিগ্রি, sorry, not 120 degree, 180 degree, 180 degree till 90 degree. Everything is okay, everything is fine, normal movement is happening. When you are taking your shoulder, your humerus or your arm from 90 degree to 120 degree, then what happens? Now since till 90 degree the humeral head can rotate freely, but at 90 degree the humeral head gets stuck in the acromial process, right? And it requires lateral rotation of the shoulder joint, lateral rotation of the shoulder joint, a movement of the shoulder of the humerus laterally, movement of the humerus laterally, then only your 90 degree to 120 degree movement is possible. Okay, above 120 degree till 180 degree you require the movement of your scapula. The scapula will move forwards, okay, your chest will move forwards. তুই নিজেও করে দেখতে পারিস, you will see your chest will move forwards. So this is the mechanism. One mechanism till 90 degree, then you have 190 degree to 120 degree, and from 120 degree to 180 degree. Kiki 90 degree the normal movement, okay, humeral head is moving upwards. 90 degree to 120 degree humerus gets laterally placed, right? And from 120 degree to 180 degree your scapula moves forwards. This is another question which is asked, okay, in your theory, okay? Describe the mechanism of abduction of the shoulder joint, right? And the movement from 120 degree to 180 degree is called overhead abduction. Overhead abduction. Here the deltoid muscle works out, right? Okay, so this is all about abduction and what happens when your axillary nerve gets damaged. Paralysis, due to which the deltoid muscle gets paralyzed and your overhead abduction is not possible. Coming to the movements, right? Coming to the movements, flexion is caused by subscapularis muscle and the anterior fibers of deltoid, and also pectoralis major, not subscapularis actually, it's pectoralis major only, pectoralis major and the anterior fibers of deltoid. Extension, posterior fibers of deltoid, okay, posterior fibers of deltoid, latissimus dorsi, right, latissimus dorsi. Then you have abduction, okay, abduction ke kore, abduction is caused by supraspinatus, I think so, supraspinatus. You have the deltoid, okay, the middle fibers of the deltoid. Adduction ke kore, most probably subscapularis, একটু দেখে নিস, না subscapularis হবে না, I think it's deltoid only, I think, বা এটা দেখে নিস, adductionটা দেখে নিস. Medial rotation subscapularis, lateral rotation also I think subscapularis is present, okay. There's a box, there's a chart in your book, right, in your shoulder joint, okay. Go through that chart about the movements, the muscles which are creating these movements, okay. So go through that chart, it's very important, just the prime movers, Okay, the prime movers, not the accessory muscles. Okay, the prime movers. Talking about some clinical ones, shoulder dislocation আমি বলে দিয়েছি, anterior one is the most common, inferior dislocation হলে কি হবে সেটাও বলে দিয়েছি, right? Then you have your painful arch syndrome. Painful arch syndrome is nothing but abduction between 60 degree and 120 degree is painful. Okay, 60 degree and 120 degree is painful. Then you have your subacromial bursitis, which is the deposition of your calcium ions, okay, in the subacromial bursa, right? And yeah, this is all about your shoulder joint. You need to basic things about shoulder joint. You need to know the type, articulating surfaces, the ligaments. You at least have to enumerate the ligaments. You have to also talk about the rotator cuff muscles. Okay, name the rotator cuff muscles, right? Then you have the coracoacromial arch, the short notes which can come on shoulder joint, rotator cuff muscles, coracoacromial arch. Okay, you have the bursas, just name them: subscapular bursa, infraspinatus, okay, and you have the subacromial or short note can come, okay, subacromial bursa. Then these three short notes can come: bursa, enumerate. Then stability of the joint, you can be asked to tell how the joint is stable. Then you have to talk about all the four rotator cuff muscles: glenoid labrum, long head of biceps, coracoacromial arch, right? You have to name the blood supply, the nerve supply. You have to talk about the blood supply and the nerve supply. About the movements, right? They will ask about the movements. What are the movements? You have abduction, adduction, flexion, extension, and circumduction, right? And the other two are medial rotation, lateral rotation. Okay, so 1 2 3: medial rotation, lateral rotation, circumduction, abduction, adduction, flexion, extension. 1 2 3 4 5 6 7 movements you need to know about. And the muscles which are actually participating in these movements, most important ones like flexion, extension, abduction, rotation, you must be knowing. Mechanism of your abduction, a separate question can be asked. Okay, mechanism, talk about the mechanism of abduction in your shoulder joint, at the shoulder joint, right? So yeah, these are the questions which can be asked: rotator cuff muscle, coracoacromial arch, subacromial bursa, then your mechanism of abduction of the shoulder joint, what are the movements of the shoulder joint, and explain why that anterior dislocation of the shoulder joint, okay, is the most common, right? And the muscles which are participating in the movements, in all the movements of the shoulder joint, that can be asked. Inferior dislocation, what will happen if the shoulder joint gets inferiorly dislocated, right? This can be asked. And yes, we come to an end of this session. Hope you all have understood some things. Just go through the book, the chart, right? The chart of muscles, that is very important. Go through it, right? See you again next time.